All right, I'm going to talk to you about how to schedule a cosmetic surgery. So you're first going to come in and see Dr. Brown. Once he evaluates you and we come up with the surgical plan for you, you'll receive your cosmetic estimate from me. This will be your official quote for everything that you guys discussed. And we can break it down into which hospitals we go to. We can break it down into different surgery plans so we can combine whatever you want to combine. And then if you decide you do want to proceed with surgery, what you'll do is you will have to pay a 20% deposit to lock in your surgery date. So what this deposit does is just secures the date that we agree upon. We can't give that date to anybody else. It locks it in. And then we're going to get you in about 2 to 3 weeks before that surgery date back to the office for your pre-op appointment. At this appointment, we will go over all your consents and expectations for surgery, your post-op instructions for surgery, what you can expect. And when you check in at this appointment, that's when your remaining balance is due in full. So when you check in, that's when you'll have to have everything paid in full. That will be due to Dr. Brown's office. We accept financing for that fee, so we accept Care Credit and Alpheon. You will also have fees from the hospital, so you'll have anesthesia and facility fees. The hospitals do not accept financing for that, so that's something that we will go over with you at your consultation. The quote that we provide you covers all the fees that you should incur. So you're going to have the doctor's fee, the anesthesia, facility fee for the hospital, all your garments that we put you in are included, and all your follow-up care. So all your post-op appointments are included in the quote that we provide for you. So we will go over how all the fees work, but we went over the 20% deposit required. We do have a cancellation policy. So if you cancel your surgery without rescheduling 2 weeks or less from your surgery date, you do forfeit that 20% deposit. That's not enough time for us to get another patient pre-opped and in your spot. So that deposit goes towards Dr. Brown's time that he lost for surgery that day. If you need to reschedule, that's no problem at all. We'll be glad to reschedule. If it does become a habit, we give you one courtesy reschedule. After that, we do enforce a $500 rescheduling fee. If you do need to cancel or reschedule your surgery date, you need to let us know as soon as possible. If you cancel or reschedule 2 weeks or less from your surgery date, we do enforce a 20% reschedule or cancel fee. So just keep in mind, we have a short window where we can get patients pre-opped and in surgery with Dr. Brown. So if you give us too short of a heads up, Dr. Brown loses that surgery time. So that 20% deposit does go towards his time that he lost for surgery.
To learn more, check out our website where you can upload your photos and concerns as a virtual consult. You can also check out our price estimator to get pricing information for all the various procedures we offer. And finally, if you'd like to have your questions answered on a future podcast or Q&A video session like this, please leave a message on our SpeakPipe. You can go to our blog page and our SpeakPipe is located there. Thanks for listening.